You won't always know if you need a crown, but one of the ways that you would know, and hopefully you'll find out during your appointment, is that if it's a tooth that's had a previous filling that's really large, or if there's an area where there's a spot of decay that tends to be fairly extensive, or especially if there's a fracture on that tooth. Once you're missing more than 50% of the tooth, it's usually the best thing to do is to get a crown placed on that tooth, or some type of crown. Fillings were not meant to restore more than half the tooth, especially with a fracture. If there's a fracture in the tooth, even by putting a filling in, you haven't fixed the fracture. You might have helped hold it together a little bit, but you know you need a crown if there's a fracture, especially if there's sensitivity related to that fracture, or if when everything's cleaned up, more than half that tooth is gone. So ideally though, you want to get that crown placed, because if you wait too long, then you could ultimately end up with a root canal and a crown.